Bismillahirrahmanirrahim. Assalamu alaikum. Welcome back my YouTube family. Here we are starting series of infectious disease. This is episode 1, part 1. Before we get started, please subscribe my channel. So let's start it. So we are studying about cephalosporin, and we are up to third generation group. I think we are on the second generation group. Cefuroxime, septin, oral, otitis media, capsule, sinus infection, cefotatin, cefoxetine, available in IV form, Bacilli fragilis, surgical prophylaxis. We are using second generation cephalosporin. Let's talk about third generation cephalosporin, Cefdinir, Omnicef, oral, CAP, sinus infection, ceftriaxone, cefotaxime, IV, CAP, meningitis, pyelonephritis, and spontaneous bacterial peritonitis. So the drug included in third generation cephalosporin, Cefdinir, Omnicef, ceftriaxone, rostipine, cefotaxime, Cefron, cefixime, Suprex, cefpodoxime, Ventin, ceftibutine, Sidex, cefditorin, Spay, Spectracif, ceftazidime, Fertus, Dazicef, cefotaxime plus avibactam, Avigas, cefotolazone, tazobactam, Zerboxa. So these are the third generation cephalosporin. It is divided into group 1 and group 2. Group 2 includes cefotaxime, IV, Pseudomonas, MDR, and gram-negative. Generation cephalosporin group 1, group 2. Group 1 including Cefdinir, Omnicef, oral, CAP, sinus infection, ceftriaxone, cefotaxime, IV, CAP, meningitis, pyelonephritis, spontaneous bacterial peritonitis. Third generation group 2, cefotaxime, ceftazidime, IV, Pseudomonas, MDR, gram-negative. GI upset, diarrhea, rash, allergic, seizure, they are the EDRs. And warnings: cross sensitivity with penicillin allergy, do not use in penicillin allergy. Cefotatin contains NMTT side chain, which may increase risk for hypoprothrombinemia, means bleeding, or disulfiram like reaction with which we have when we take alcohol patient. So contraindication: ceftriaxone, biliary slugging in neonates, so hyperbilirubinemia, concurrent use of IV calcium containing products in neonates 28 से जो लेस यानी जो बिलो एज डेज बच्चे हैं उनमें यूज़ नहीं करनी, कॉन्ट्राइंडिकेटेड है. नो रीनल एडजस्टमेंट रिक्वायर्ड. Chewable source also available of cefixime and convert some CRE. Okay, fourth generation covered Pseudomonas, same ADRs, warning as we have covered in third generation. And fifth generation for MRSA treatment. Fourth generation cefepime, ceftaroline is Fosamil, telfar, fifth generation available. Okay, let's talk about. There are few terms we have used in last previous slides, so I need to clarify it. There's the word we have used to convert from CRE. It's mean the carbapenem resistance enterococcus bacteria. They work for it. The drugs is third generation group 2, and tedizolid, which is the Vestro oxazolitones. This converts with vancomycin resistance enterococcus bacteria. And the word we use approved for SSDI is skin and soft tissue infection. So let's move on the current one, which is ciprofloxacin ciprofloxacin. Okay, and so FQs is fluoroquinolones, ciprofloxacin, available brands Cipro, levofloxacin, levaquin, moxifloxacin, moxifloxacin, sorry, Evilox, dalafloxacin, Boxdela, ofloxacin, gatifloxacin, Zymazid, gemfloxacin, which is active brand available in international. Topoisomerase IV and DNA guidase, concentration dependent, and respiratory fluoroquinolones, levo, moxi, and jami. If we have respiratory infection or they are asked about respiratory fluoroquinolone, then we levofloxacin, moxifloxacin, and gemifloxacin. The first line we have used in respiratory infection, which is levofloxacin. Anti-pseudomonal Cipro and levo. So if the condition is like a GI disturb, so you go for Cipro. Okay, dalafloxacin IV or oral 1:1 equal है. Used for skin infection, active against MRSA. ADRs: nausea, diarrhea, headache, dizziness, insomnia, serious and tan. And what does it mean? It is about tanning and sunlight affected. So tendon inflammation, rupture, peripheral neuropathy, CNS defect, or some cause of seizures. It's warning, contraindication, tizanidine, ciprofloxacin, coleates, caution, warning, with caution. Use coleates with caution. QT prolonged, moxifloxacin higher risk, hyperglycemia, hepatotoxicity, photosensitivity, muscle toxicity, avoid in child. But right today, nowadays, ciprofloxacin is available for our children dose and for children. Moxifloxacin, no renal adjustment required if you are using moxifloxacin. No use in UTI. Moxifloxacin, there is no use of moxifloxacin in UTI. Won't distribute to urine because there no route to go for a urinary part. Cipro oral suspension, never give through NG nasogastric feeding tubes. तो Cipro oral suspension NG tube और feed tube से नहीं देनी है. सिप्रो टैब्स फीड ट्यूब ओके. अगर टैबलेट आप दे रहे हो तो ओके है, लेकिन सस्पेंशन नहीं देनी है. उसका रीज़न ये है, आई थिंक कोई सी भी एंटीबायोटिक जो मोस्टली सस्पेंशन है वो आपको ट्यूब फीडिंग ट्यूब से नहीं देना चाहिए. उसका रीज़न ये होता है कि वो कहीं ना कहीं कुछ ड्रग्स होती हैं जो प्लास्टिक और इस तरह की चीज़ों से इंटरेक्शन होता है उनके केमिकली उनका स्ट्रक्चर्स में, और समटाइम ये होता है कि वो स्टिक हो सकती है, तो कॉन्सेंट्रेशन वो वैसे नहीं जाएगी जो जानी चाहिए. So now talk about macrolides, which is azithromycin, clarithromycin, erythromycin, Azithromax, Z-Pack, clarithromycin, Bioxin, erythromycin ES, Aditab, Adipede, erythrocin, PCE. So they are macrolides, work on 50S ribosome, strong 3A4 inhibitor. Azithromycin, least of all used for CAB. And ALT history for strep throat, and azithromycin COPD, exacerbation, chlamydia, gonorrhea, MAC, MAC prophylaxis, DOC for traveler diarrhea. So we can use it in traveler's diarrhea. So there is one. GI upset, erythromycin most GI upset cause करती है. Increase LFTs, and will be the same is with sunlight effect, photosensitive. QT prolong, highest risk erythromycin है, hepatotoxicity हो गई. Do not use with the lovastatin or simvastatin, cause potential muscle toxicity. All except azithromycin not cause any muscle toxicity. Okay, Z-Pack, which is I think azithromycin 500 mg per day, 250 BD to 2 to 5 day, or azithromycin ER suspension. If you are using 500 strength of azithromycin you are using if you are taking for a day 1. So if you are using 5 to 10 days to complete this course, 2 to 5 days, which is recommended dose for its antibiotic, so you have to take a PD form. Okay, we also use azithromycin in mostly acne cases when you have a resistance acne. So we are using in which is a 3 month to approx 2 month course. So I'm not prescribing, I'm just telling you this is how we use it, but we are using mostly in BD form. Okay, so azithromycin ER suspension, Zmax not equivalent to Zithromax. So Zmax and Zithromax both are available brand name Zmax and Zithromax, but they are not equivalent if you are using ER suspension. So let's talk about tetracycline, doxycycline, minocycline, teracycline. Doxycycline available Dorex, Dora, Monodox, and Oracia. Minocycline, Minoxin, Solarin, Minolira. Tetracycline works on 30th ribosomes, Doxy, Mino, CA, Marsa, caution and skin or acne में जाती है Doxy. Okay, lymph disease, rocky spotted fever, CAPS, COPD, VR, UTI, resistance. It's about vancomycin resistance. Chlamydia, gonorrhea, tetracycline, H. pylori में प्रिस्क्राइब किया जाता है. H. pylori की जिस तरह की रजीम होती है, स्टडी अबाउट उसमें टेट्रासाइक्लिन भी ऐड होता है. Nausea, vomiting, diarrhea, photosensitivity, drug induced lupus, chelation, they make chelation, magnesium, aluminium, calcium. So you are not using this or not giving with this combination. So you are not giving in renal lactate. Iron products, sucralfate, bimuth, salicylate, and bile acid resin separate dose. You need to separate dose. So if you are using H. pylori condition, so there is a condition in H. pylori. We also use sucralfate and bismuth salicylate. So what does mean? We also using tetracycline. So we need to separate the dose of both of these. Not recommended in pregnancy and breastfeeding or the baby 8-year say less so we are not using this. IV and oral in any form is equal. Notes: dose based on TMP component SS 400 by 80, DS 800 by 160. Uncomplicated UTI 1 dose tablet BT for 3 days. Thanks for watching. If you like this video, please subscribe, like and share my video. Also mention your any queries related to pharmacy in comment section. Allah Hafiz, until next time.